school can be exciting, but very nerve-wracking at the same time. And with all the body image pressures hitting our kids today, they can develop eating disorders if they let those pressures get to them. A new government study shows children as young as 5 and 6, can you believe that, 6, are worried about their weight. Dr. Denise Milstein will help us understand the warning signs. But first, Kim Covington shares one teenager's emotional struggle with an eating disorder.
Over 50% of teenage girls and a third of teen boys are either anorexic, bulimic, or obsessed with weight loss. Listen carefully to the 15-year-old you're about to meet who is undergoing treatment. We're calling her Lisa and protecting her identity. Her story could help someone you know.
Lisa is an extraordinary student and talented dancer. What I see is a beautiful 15-year-old girl. But that's not what she sees.
I just hated the way I looked.
Like many girls, Lisa thinks looking like these bone-thin celebrities equals beauty, success, perfection.
I mean, I remember being 8 years old and asking my mom if I was fat.
That's how young Lisa was when negative images of herself started saturating her brain.
I counted all the calories I ate. I was pretty much only eating lean cuisines and pre-made meals where I knew exactly how many calories I was eating. And I kept track, and I worked out enough so that I would burn off the calories I was eating.
You were thinking about that at 8 years old?
Yeah.
Her eating disorder started small and quickly escalated.
I would sit in school and think about how hungry I was. I would tap my foot to burn extra calories. I would sit at lunch and peel the skin off my grapes so that it would take up more time, so that I wasn't so focused on eating. It was a way to distract me from eating. I mean, there were actually points that I would sit in class and try to swallow my spit to make me feel more full.
Lisa was able to hide that behavior for 7 years before she cried out for help.
Eating disorders are the most deadly mental health disorders of any disorder. It's 4 to 6% of people who have a diagnosable eating disorder will end up dying as a result of their eating disorder, typically by heart failure, if you're anorexic, or by suicide with bulimia.
Jan and other therapists at Doorways are helping Lisa identify what's triggering her behavior and why she uses food to control her life and build her self-esteem. Doorways specializes in treating eating disorders and other mental illnesses for teens and young adults. Lisa's still not out of the woods, but at least food is not the enemy anymore.
It's always going to be something I think about. I don't think there's going to be a day that goes by that my eating disorder doesn't come into my mind. But I really hope to stop the behaviors and be able to take control of my life.
For EVB Live,
And that was Kim Covington once again. Dr. Denise Milstein joins us with some insight into what causes these young teens to turn to eating disorders as a solution for negative body images. You know, in hearing Lisa's story, her behavior is already so disturbing, but I was startled to know that boys are now suffering from anorexia.
Isn't that true? We think of this as being a disorder of adolescence and of particularly adolescent girls, but we're seeing it more and more often in boys, and it typically starts in adolescence for all patients with eating disorders.
Why is that?
Well, we believe it's because of the culture, because of what we really hold out as the optimal body image. And truly, these patients and these people see their body differently than we see it. They look in a mirror and they see fat, where they might be a very normal or even underweight.
Intervention is key. You gotta get to your kids early.
So that's what we know. The earlier we diagnose it, the better they do. So it's really important that parents particularly pick up on any of the warning signs. So some of the first things that they'll notice is that their kids are focusing on food. They might start to lose weight, but that's actually a pretty late sign. In fact, what they'll start to do is pull away. They won't want to eat with the family. They might even stop having periods for girls, and they might start to lose hair. So if you start to see more hair in their brushes or in the drain, you need to to be worried and bring that to your pediatrician's attention.
And what other tips do parents need to know when dealing with this and getting a handle on their kids?
So most importantly, I think parents need to advocate for their children. When they see these warning signs, they need to go to the pediatrician and talk to them about it. And if they feel like that has not been recognized to the extent that they think it's important, they need to speak to a specialist. So at St. Joseph's, we have an eating disorder and adolescent medicine clinic. In fact, it's the only one in the Valley. I spoke to Dr. Banakaram yesterday, and she said it is incredibly important that these kids get brought into care. And if it's that serious, that they be seen by a subspecialist who's trained and who can spend more time on this particular issue, which, as you just heard, can be life-threatening.
Absolutely. Dr. Denise, thank you so much for your time.